Welcome to the Midland Moment Podcast, the podcast dedicated to telling the story of Midland through the eyes of its employees. I'm your host, Jeremy Wiltz, and with me today is Sarah. Sarah serves as the director of Community Care Hospice in McPherson, Kansas. And Sarah has been working at Community Care in that capacity for about the past year. Sarah, welcome.
Thank you.
So Sarah, to give kind of our listeners a little bit of background, community care may not be something that people in the Topeka area have heard as much about. So can you tell us what Community Care Hospice is and what kind of area it serves?
The Progressive Health Alliance started Community Care Hospice. There are 13 communities that are members, and we cover 6 different counties. And we just like to be known for contributing to extending the quality of care that our communities are offering the patients into their hospice services.
Yeah, and it's a cool process that we were able to go through with Progressive Health Alliance, which has a lot of not-for-profit senior care facilities in it. To where we could really sit down and, like Sarah said, try to become an extension of the great care that they are offering their patients. And it really was kind of a cool addition to our service area because it kind of travels from the Salina area clear down to Wichita and then kind of back to the east. And it really kind of almost butts up against where Midland Care service area is. And then if we remember from last time with VNA on there, VNA butts up on the east side. So it really creates this nice little corridor. So Sarah, tell me a little bit about, your career and what led you to whether it's, education and then what jobs you've kind of had leading up to community care and what kind of led you to community care.
All right. Well, the whole thing started when I had my son, and I started working in the dietary department at the Cedars in McPherson, and really just enjoyed what I did and really wanted to move forward with that. So they were offering CNA classes. So I took my CNA and they helped me with that. And then I took my Med-Aid. And then went on to get my LPN, and then 6 years later got my RN. So in 2010, I graduated with my LPN, and in 2015 with my RN. I started doing dialysis in 2015 and then moved into the home health side of things in 2016. Unfortunately, in 2020, my dad passed away. So that kind of moved me to the hospice side of things. And I just kind of feel like I've figured out what I need to do and where my place is.
Yeah, and I thank you for that story and for the passion that you have for the hospice side. And I've had the opportunity to work with Sarah over the past year and really have seen her desire to care for those in these facilities in a way that gives them the dignity and the compassion that everyone deserves in their last days on hospice. And so that's been really fun for me to see from that standpoint. And I know that the facilities that you get to be in every day really appreciate it as well. So when you came to community care, we were still a pretty fledgling little hospice. We still kind of are a little fledgling hospice. We're about a little over a year into this, have, anywhere between 15 and 20 patients on any given day, starting to grow slowly within those communities. What made community care stick out in your mind? What made you want to give Midland and community care kind of a shot as part of your career?
It's always been kind of a dream of mine to help build something from the bottom. And I felt like with the support and everything that we were receiving from Midland, that this would be a good fit for me to try that out and see how it went.
Well, and I think that I speak for everyone that's gotten to work with you. You have been such an integral part of our growth down there. Sarah spends a significant amount of her time interfacing with all of the buildings, in addition to our marketing staff down there, and she's well known in each of the buildings. And is a really integral part of what's going on there. So, Sarah, as you've built your team there, tell us a little bit about kind of the size of the team, the number of people that we have kind of down in that area.
So we have a full-time nurse. We are currently looking for another full-time case manager with our growth. We have 2 PRN nurses, 2 full-time CNAs, a full-time chaplain, and a full-time social worker.
And that staff are able to, right now they serve, like Sarah said, through 6 counties, spanning a fairly large territory. And that's been an interesting part of this, really serving rural healthcare. Sarah, I'd love for you to talk a little bit about kind of as you've built this team and you continue to build community care. What values do you feel like you've been able to input into community care? And also what values do you feel like you've seen through Midland that get you excited about where community care could go?
I'm going to say the support that you see everyone receiving, whether that's someone through Midland or through CCH. I feel like we all receive a genuine amount of support, and it doesn't matter what the issue is. I feel like there's always somebody that we can go to get that figured out and move forward. So that is one of my favorite parts about working for Midland and CCH.
Yeah, and I think it's timely that you say that. For those of you, especially on the clinical side, you'll know that we've been rolling out the model visit, and Sarah's been involved in that as well. And one of the things that's in the model visit is do the extra. And I think that really speaks to kind of what Sarah's talking about, I've been very grateful as one of the people that got to help start community care, of all of the people that have stepped in and have provided support, whether it's Chris with advertising, or it's Patrick from marketing, or it's Marsha and Jenny from a leadership position, or it's Sarah stepping in when, we're short a nurse and being willing to sit at the bedside of anyone that needed it. Everyone has gone above and beyond to make sure that those patients get what they need when they need it, regardless of how convenient it is for their lives. There was also a time at Community Care where when we were in between directors and still looking to find Sarah before she got there, and Susan Spielman and Crystal have both spent significant time down there moving that through. So I do thank everyone for that going above and beyond. And I agree with you, Sarah. I think that's one of the coolest things that I've seen at my time at Midland is when support is needed, everyone steps up and does that. So we're entering 2025. What gets you excited about this next year at Community Care?
Probably the growth and the relationships that we're forming with all of our communities that we serve. Every day those relationships grow. And so I'm really looking forward to where those are going to head us in 2025.
Yeah, and I think I agree with you on that. I think we're starting to see some really cool relationships start to blossom down in that area, and we're filling a need that wasn't there. For those of you from the central Kansas area, you know that there are hospices there, but there's never really been this concept of a not-for-profit helping not-for-profit facilities. For those of you wondering kind of what Midland Care's role is in this, so Sarah is an employee of Community Care. Midland Care acts as the back office for this. So we help with the billing, help with some strategic leadership, help with some marketing stuff, help with communications and those sorts of things. But Sarah and her team are really who provide the care every day. And we're so grateful for the work that you do every day. I've heard lots of great stories already of the care that's been provided under your leadership, and I thank you for that. So before we go, I always like to ask people a fun question just to kind of end things. And I've kind of stuck with this one for a while, but so Sarah, when you were a kid growing up, was a nurse what you knew you wanted to be, or what did you want to be when you were a kid? What was Sarah's dream job when she was a kid?
I was going to be a cosmetologist.
So when did that dream of being a nurse, was it after, you talked about the birth of your child and kind of going back to school? Was that dream there before that, or was that kind of what made you feel like healthcare was where you wanted to be?
I think that kind of pointed me in the direction of healthcare.
Well, we are grateful to have you as a part of the Midland team. And it's really cool to be able to start to see different pieces, different affiliates, whether it's VNA, Midland Care Meals on Wheels, or Community Care Hospice, and how we can continue to form a care continuum for seniors that's really exciting and something that no one else in our area really can do. So thank you, Sarah, for joining me today. I know you have a long drive home, and I appreciate you taking the time to sit down and talk to us.
Thank you.